Hello, welcome to this session of Introduction to MAGI Policy. This is designed to help you have a better understanding of the MAGI rules that will begin on October 1st for our families and children applications. My name is Denise Short and I will be your facilitator for this session. Now let's take a look at our PowerPoint presentation. Acronyms. We have our special way of talking, and beginning October 1st, we'll have some new acronyms to add. The first one is APTC, Advanced Premium Tax Credit. This is a tax credit that will be available to persons who purchase health insurance policies through the health insurance marketplace. The next one is CMS, Centers for Medicare and Medicaid. This is the federal organization that helps us with our rules and regulations for medical assistance. CN, Categorically Needy. This is actually not a new acronym, and we will still be looking at the categorically needy covered groups. MA, Medical Assistance. Medical assistance is what we will now refer to when we're speaking about Medicaid, famous moms. MAGI, or some people say MAGI. This is the Modified Adjusted Gross Income methodology that we will begin using in October. MN, Medically Needy. Again, not a new terminology, but we will still be looking at medically needy covered groups. And VACMS. VACMS is the Virginia Case Management System, which we will begin using for families and children medical assistance applications beginning in October. Once Transmittal 98 is released, you will see information regarding the following items: applications, application processing, changes regarding citizenship and identity documentation, Virginia residency, Social Security number requirements. There will also be a new covered group starting in January. This group is called Former Virginia Foster Care Children who are under the age of 26. We'll talk more about that a little bit later. There will be no verification of pregnancy required beginning in October. We will take a client's statement that they are pregnant. They will document the estimated date of conception as well as the estimated date of delivery. The hierarchy of families and children medical assistance groups for both children and adults will have a slight change. We have planned first income limit changes as well as changes for famous moms. Let's move forward. Transmittal 98 will have the biggest change with Chapter M04. This will focus all on MAGI. Chapter 4 will be MAGI related for all families and children evaluations, including household compositions, income calculations. We will include information about income differences as well as examples of income and household compositions. MA, medical assistance, again, meaning Medicaid, famous moms. The various application types that we have are as follows. Online through Common Help. Persons are able to apply online now, and the biggest change will be a self-directed process that the system itself will carry through. When an applicant has filed online and they have all of the required information, the worker may not have to touch that application at all until it comes time to pull off the notice of action, mail it, or refer that applicant to the federal health insurance marketplace. Telephone applications will be taken by the Cover Virginia call center. Paper applications will still be available and can be submitted by mail, fax, or in person. The federal health insurance marketplace. This is where persons will be referred when they are found ineligible for medical assistance through a local agency, but they may also apply through the federal health insurance marketplace on their own. There will be application assistance. Two categories of these application assistants are called certified application counselors and navigators. Let's take a look at the application assistants. They will be persons who are helping people apply for medical assistance as well as health insurance tax credits. They will usually be supervised by a nonprofit organization, and they do not receive a fee. The Navigators, they too will help people apply for medical assistance and the health insurance tax credit, but unlike the counselors, they may be insurance professionals or other tax professionals, such as, if you remember when H&R Block and Jackson Hewitt were advertising at the beginning of the year, they made a little statement right before the commercial ended saying you may be eligible for health insurance. Unlike the navigators, unlike the counselors, these navigators will be able to receive federal funds. Both counselors and navigators must meet certain requirements that are set by the federal government. Unlike an authorized representative, they cannot sign an application for the client, and they will not be able to receive notices, and they will only have access to some of that applicant's information. There will also be new application forms for medical assistance. Our first form, application for health coverage and help paying costs, is in two forms. There will be one form for multiple individuals, such as households that are applying, and then there will be a short form just for single individuals who are applying. These applications are based on the streamlined requirements set by CMS, and they will also gather information that's needed if an applicant is referred to the health insurance marketplace to be evaluated for the advanced premium tax credit. Our current application for assistance is being revised. The following forms will be obsoleted out for medical assistance applicants. If you should receive a form in your agency after October 1st, you will still honor it. The following forms are application for benefits, the application redetermination for Medicaid for SSI recipients, the Medicaid application redetermination for medically indigent pregnant women, the health insurance for children and pregnant women form, known as the blue and white famous form, the application for adult medical assistance form, and the Plan First application form. Remember, beginning October 1st, you should not be giving out these applications to any clients. Application processing, we're working towards a single application with a no wrong door policy, and we've been striving for that for some time now. We will be using electronic data to verify some of our information, and this will be coming through the Federal Hub. Please note, the Hub can only be used for medical assistance eligibility verifications, and other assistance programs are not using the Hub for verifications. We want to be able to process applicants as soon as possible, but we still have our normal 10-day, 45-day, and 90-day processing times remaining when it's necessary to use those. The Hub will link into the following federal systems: Social Security Administration, the Internal Revenue Service, our SAVE system, and you will be able to retrieve information from the Hub from these federal systems. At this time, other sources such as the work number does not tie into the Hub, but may be later available at a later date. Self-attestation or self-declaration will also be utilized in several areas. We will take self-attestation for verification of residency and pregnancy. Please note, even though pregnancy will be met the first day of the month the client states pregnancy began, we will still follow our current application rules, such as the date of application and the 3-month retro period when we are evaluating that applicant. Also in line with verifications, when it comes to income, we're looking at what's called reasonable compatibility. Usually, if the declared amount is within a 10% range of the verified source, then the declared amount will be considered as verified. For example, your client has declared that they earned $2,000, and the hub comes back and says that they earned $2,005. That's within a 10% range, so we will be considering the $2,000 as the verified amount. However, if the declared income is under the MA limit for the group that you're looking at, but the electronic source is over, you will request additional verifications. Even when reasonable compatibility exists, the applicant must be given the opportunity to present any verifications of income if his attested income is under the income limit, but the electronic source is over that limit. Therefore, should the attestation be under the MA limit and the electronic source be over, and the difference is within a 10% range, requesting additional verifications will be needed. When the two sources are not within a 10% range and the following situations apply, please do the following rules. If both sources are under the MA limit, then this person will be found eligible for medical assistance. If both sources are over, they will be found ineligible and referred to the federal marketplace. If the declaration is over the MA limit, but the data source is under, they are found ineligible for medical assistance because we are assuming the client knows what their current income information is. Whenever an MA application is denied because of excess income, we will be sending a notice of action advising the client of the application decision and also referring that application to the federal marketplace, and that will be done via the VA CMS system. For citizenship and identity, any applications that are processed through VA CMS will have an automatic data match done via the hub. For applications that are not processed in VA CMS, the Social Security data match will be processed as it is currently being done through the MMIS each month. Whenever any documentation is required, photocopies are now acceptable beginning 10/1. Verification of residency and Social Security number requirements. We will now take the self-declaration from the client. If the client states that they are living here in Virginia and intend to reside, then we will take their statement. You will no longer have to ask, are they staying here permanently or indefinitely? You will only need verifications if there is reason to question. Please make sure you document your case as to the reason why it was questionable. This self-attestation will also include aliens that are here on visas. Social Security numbers will be required for all medical assistance applications. That includes Medicaid, FAMOUS, and FAMOUS Moms. It will not be required for Medicaid emergency services aliens or our deemed newborns. The new covered group, families and children, will now have a new covered group beginning January 1, 2014. This will be a group of former Virginia foster care children who are under the age of 26. You will verify this with the agency that held their custody. They must have been in Virginia foster care on their 18th birthday. They must have been enrolled in Virginia Medicaid on their 18th birthday. They must be ineligible in any of our mandatory categorically needy groups such as LifeC, PG Medicaid, Children Under 19, or SSI. There will be no resource or income test for this new covered group. Their aid category in the MMIS system will be 070. And as you can see from this slide, entitlement will begin the first day of the month following the month they are no longer in custody of Virginia-based foster care agencies, provided they were enrolled in Medicaid during the month foster care ended. But this coverage cannot begin prior to January 1 of 2014. Our families and children hierarchy, or what we know as our processing system for children, will have a slight change because we will now include the former Virginia foster care children in our first line of evaluation. Remember, we always look to see if the applicant will now be a former Virginia foster care child, or if they are a current foster care child, adoption assistance child, special medical needs adoption assistance child, or an individual under age 21. We always evaluate in these groups first. If not group 1, we look at the second line. Does the child meet the newborn definition? And if so, we evaluate them in that pregnant woman newborn group. If not there, is the child under the age of 19? And if so, we'll evaluate them in the Medicaid child under 19 group. Does the child have excess income for Medicaid? Then we evaluate for famous child. And last but not least, if the child is under the age of 1, under the age of 18, under the age of 21, or is a special medical needs adoption assistance child, and their income exceeds all of the other groups, we will then provide an opportunity for them to be evaluated as a medically needy child. Our hierarchy for adults and families and children will also have a slight change. We will now look at, beginning in January 1, 2014, if the adult is a former foster care child who is under the age of 26. If so, we evaluate in this category first. If not, beginning 1/1/2014, do they meet the definition of a parent/caretaker relative and be evaluated in the Life C group? Should they not be Life C, do they meet the pregnant woman definition? And if so, we will evaluate them in the pregnant woman newborn child group. Have they been screened and diagnosed with breast or cervical cancer or any precancerous conditions by Every Woman's Life program and not meeting the definition of the prior groups? Then we will evaluate and enroll in the BCC PTA group. Remember, evaluations for this group is actually being done, the screening by Every Woman's Life program. If individuals have excess income for full coverage medical assistance and they're age 19 to 64, then we evaluate them for Plan First. And if the individual is a pregnant woman, their income exceeds medical assistance in the categorically needy pregnant woman group, we will evaluate them for famous moms. Famous moms applications must be evaluated and submitted before 12/31/13. If they are found ineligible in these groups, we will provide an opportunity to be evaluated under the medically needy category. In our families and children hierarchy for children, which we also call sequential processing, we will begin to look at foster care child, adoption assistance child, special medical needs adoption assistance child, any individual that's under the age of 21, and evaluate in those groups first. Beginning January 1st, we will also include the former foster care child that's in Virginia under the age of 26. If a child is not found eligible or qualifying for either of these groups, we will move to the child who meets a newborn child definition and evaluate, can they be a newborn child? If not meeting the newborn child definition, do they meet the child under age 19? And evaluate in that Medicaid child under 19 group. Do they have excess income for medical assistance or Medicaid? Then we will evaluate for famous. The child under age 1, under age 18, under age 21, or is a special medical needs adoption assistance child, and income exceeds the appropriate Medicaid and famous income limits, will still have the opportunity to be evaluated as a medically needy child. For our adults, again, our families and children hierarchy, starting in January 1 of 2014, we will look at the former foster care child in Virginia who's under the age of 26. We will evaluate in this covered group first if they meet that determination. If not, do they meet the definition of a parent/caretaker relative? And if so, we will evaluate in the Life C group. If not Life C, do they meet the pregnant woman definition? If so, we will evaluate in pregnant woman, newborn child group. If the person has been screened and diagnosed with breast or cervical cancer or precancerous conditions by Every Woman's Life program and is not meeting the definition for coverage in a prior covered group, then we will evaluate them for the BCC-PTA group. If the individual has excess income for full coverage Medicaid and is between the ages of 19 and 64, we will evaluate in the Plan First group. If the individual is a pregnant woman, has excess income for Medicaid in the categorically needy pregnant woman group, and for famous moms, we will evaluate as a medically needy pregnant woman. Our Plan First income limit changes will be effective on October 1 through December 31st, 2013 by increasing to 211% of the FPL. Beginning in January 1 of 2014, the income limit will change to 100% of the FPL. Changes for famous. All famous applications that are submitted to a local agency on or after October 1 of 2013 will be maintained by that local Department of Social Services. All active famous cases will be converted and transferred to the local Department of Social Services beginning in 2014. Any famous applicant must provide a Social Security number or show proof that they've applied for Social Security numbers. And for a temporary moment, a new protected covered group of children will be available for those children that are currently enrolled in Medicaid and are found Medicaid ineligible at the renewal time because of loss of disregards will be eligible for famous for 1 year. They will be considered protected children. With famous moms, after December 31st of 2013, no new famous moms applications will be evaluated. The Famous Moms program will end no later than December 31st of 2014. Any active Famous Moms cases that are currently being maintained by the Famous CPU, they will hold on to until that person has reached their 60-day postpartum period. Famous Moms applications approved by the local Department of Social Services beginning 10/1/2013 and later must be maintained by that local agency. Again, for Famous Moms, pregnancy verification will not be required. The self-declaration will be sufficient. Famous Moms applicants must again provide a Social Security number or show proof of applying for a Social Security number. And the income limits for Famous Moms will increase to 210% of the FPL beginning 10/1/2013. On to the new chapter, MO4, Modified Adjusted Gross Income, also known as MAGI. Effective dates for this MAGI will begin on or after 10/1 of 2013. So any applications you receive between now and September 30th should be processed using the current methodology or non-MAGI rules. For renewals that are completed before April 1st of 2014, they too will be under the non-MAGI rules. Renewals completed on or after 4/1 of 2014 will be processed by MAGI rules. Any individual who is in a Families and Children Covered Group in an institution, hospice, or CBC services, or considered families and children medically needy will still be evaluated using non-MAGI rules. So, we've been talking about MAGI, and exactly what is MAGI? It's modified adjusted gross income, and it's a methodology. MAGI is not a covered group. MAGI is not a new program. It's how we will determine our household compositions and family sizes, and also how their income will be counted. MAGI is not a number on a tax return. MAGI is based on federal tax rules for determining adjusted gross income with some modifications. There will be no asset test or disregards except a 5% FPL disregard, which we will discuss a little later. So which covered groups will have their eligibility based on the MAGI methodology? Children evaluated under 19, parent taker relatives of those children under the age of 18 who are being evaluated for LifeC, pregnant women, individuals under the age of 21, such as non-4E foster care children or non-4E adoption assistance children. Others are listed in Chapter MO330.107. Anyone being considered for Plan First evaluation, as well as famous children and famous moms. Their eligibility will be based on the MAGI methodology. Eligibility will not be based on MAGI methodology for the following. Any individuals for whom the local agency is not required to make a Medicaid income determination, such as our SSI recipients, our 4E foster care or adoption assistance recipients, deemed newborns, and the Breast and Cervical Cancer Prevention and Treatment Act enrollees, also known as the BCCPTA. Individuals who are under the coverages of aged, blind, and disabled. Also those individuals who need long-term care, known as LTC. And again, our individuals that are adults under the medically needy eligible individual coverages. Persons who are enrolled in the Medicare savings programs, such as QMB, SLMB, and QI, will not be evaluated with MAGI methodology. So a summary of our MAGI covered groups again: all adults, anyone for whom the agency is not required to make income determinations, parent and caretaker relatives for LIFC, children under the age of 19, as well as pregnant women will be evaluated under the MAGI methodology. For the MAGI household and income rules, these are the effective dates. Again, any application that is submitted before 10/1, we will use the following subchapters in the Medicaid manual. Chapters MO510, MO520, MO720, and MO730. Beginning on and after 10/1, we will be using Chapter MO4, the MAGI chapter. For renewals, any renewals completed before April 1st of 2014, we again will use chapters MO510, MO520, MO720, and M0730. For renewals completed on or after April 1st of 2014, we will use Chapter MO4, the MAGI chapter. For our individuals that are in institutions, hospice, CBC services, or found eligible for medically needy coverages, we will use our current chapters of MO510, MO520, MO720, and MO730, regardless of whether it's an application or a renewal. So let's talk a little bit about the MAGI methodology rules. As we stated earlier, there will no longer be disregards as we have currently known. The $90 disregard will no longer be in effect. Disregards for child care services, disregards for the child support income, the $50, that will no longer be effective beginning 10/1. But there will be a 5% FPL disregard. And this disregard will be used or considered if the income exceeds the income limit for the person's covered group. Then 5% of the FPL for their household size will be subtracted from their gross household income. This will result in what we call a countable income, which will be compared to the covered group's income limit. If the individual is potentially eligible in more than one covered group, when the 5% FPL disregard is subtracted, we will compare the results to the income limit of the potential full coverage medical assistance covered group or Medicaid covered group that has the highest income limit. We will have some new ways of thinking and talking. Tax dependence. Tax dependents in a tax filer's household may not necessarily live in the taxpayer's home. So we will be talking in terms of tax filers and tax dependents. Each applicant's eligibility will be determined in their own household with his or her own household size. And an individual may be counted in more than one household, but their eligibility will only be determined in the one household in which they live. Households will be looked at as tax filers and non-tax filers. So when we consider non-filer rules, that's when a household does not file taxes. We'll also use non-filer rules when the applicant is claimed as a tax dependent by someone outside of that applicant's household. We'll use non-filer rules when both parents are in the home and file their taxes separately. Non-filer rules may be used in a multi-generational household. Married spouses that live together are always in a household together, and this is pretty much the same as we do now. Married spouses that live apart but file taxes jointly are now considered a household together. The child's income is not counted if that child is not required to file taxes. The exception will be when the child is a parent of a non-filer child in the home. So when we talk about establishing tax filing statuses and tax dependency, the filing requirements in tax dependency will be based on reasonable expectations at the time of the determination. And if a taxpayer cannot reasonably establish tax dependency relationship, then inclusion of that tax dependent in the household will be used by determining non-filer rules. Okay. Let's look at some MAGI definitions. We have already determined that MAGI is adjusted gross income with some modifications. The adjusted gross income will include any foreign earned income that is currently excluded from taxes, any tax-exempt interest, as well as Social Security benefits. Please keep in mind, Social Security benefits do not include SSI benefits. The household will equal the taxpayer, and that includes any married taxpayers, and all claimed tax dependents. The household size will equal the number of individuals in the household, A pregnant woman's household will include herself and any unborn fetuses only for her household size. When we're determining a family size of other individuals and a pregnant woman is included, that pregnant woman is counted just as one person. The household income will be the sum of the taxpayer's MAGI plus the MAGI of tax dependents in the family. For MAGI countable income, taxable income will be counted for medical assistance purposes. Non-taxable income will not be counted with the exception of Social Security. There also will be the exempt interest income and the foreign earned income. These are the exceptions to the rule. There will be adjustments to AG, allowed or adjusted gross income. The key differences when we compare to the current methodologies are child support income will no longer be counted when it's received as income. Self-employment and farm income will be counted after the deduction of depreciation and capital losses. There will be certain Veterans Administration benefits not counted, and workers' compensation benefits will not be counted. Remember, we're looking at taxable income. Taxable income, again, that will not be counted in MAGI. These are current rules for Virginia. Scholarships, fellowship grants, and awards that are used for educational purposes will not be counted. Again, this is the current rule. American Indian and Alaska Native income that is derived from distributions, payments, ownership interests, and real property usage rights will not be counted. And lump sum is only counted in the month of receipt. Again, these rules are in our current policy. When it comes to the MAGI household composition, we will look at taxpayers and tax dependents using that tax household with limited exceptions. So this really means that in vast majority of cases, a household will be determined by the principles of tax dependency. Parents, children, and siblings are included in the same household, and this will include step-parents. Step-parents and parents will be treated the same way. Children and siblings with or without income will be included in the same household as the rest of the family, and any older children will be included if they are claimed as tax dependents by their parents. A child with earned income, that income will not count if that child is not required to file a tax return. The exception again will be when that parent is the parent of a child in the home under 19. Each individual applicant's household is determined separately. And as stated earlier, we will have two types of households, a tax filer household and a non-tax filer household. Non-tax filers can be in a tax filing household. Some of the differences between tax filers and non-filers: an extended family can include family members and unrelated individuals that are claimed as tax dependents by that taxpayer who is not a parent or spouse. For example, it could be the taxpayer's grandchild or the taxpayer's parents may be tax dependents. Any children of non-custodial parents, when that child is claimed as a tax dependent by the tax parent when the child does not live with the taxpayer parent. We know couples who are no longer together, divorce, and the non-custodial parent sometimes claims that child or children on his or her taxes. Children of unmarried parents, or what we currently call the acknowledged father rule. If parents are living together with that child, we will include both parents in that child's household. The tax-dependent exceptions. There will be 3 questions we will ask to determine the tax-dependent exception. The first will be, is the individual the tax dependent of someone other than that person's spouse, biological parent, adopted parent, or step-parent. Is that individual a child under 19 who lives with both parents, but the parents do not expect to file a joint tax return? Third question, is that individual a child under 19 who expects to be claimed by a non-custodial parent? For non-tax filer household compositions, we will mirror the tax filer rules to the extent possible. Spouses, parents, step-parents, and children living together will be included in the same household. For the non-tax filer rules, a child is defined as being under the age of 19. Rules for the non-filers will also apply to tax dependents accepted out from the general rule by using the tax definition of household. For MAGI household composition non-tax filers, we will mirror the tax filer rules to the extent possible. Spouses, parents, step-parents, and children that live together will be included in the same household. For non-tax filer rules, a child is defined as being under the age of 19, and rules for non-filers will also apply to those tax dependents who have been accepted from the general rule of using the tax definition of household. Also for non-tax filer households, individuals who neither file a tax return nor are claimed as a tax dependent, that household will consist of the individual and, if living with that individual, the following persons: that individual's spouse, that individual's natural or adopted children, as well as stepchildren under the age of 19, that individual's natural or adopted parents and step-parents when that individual is under the age of 19, the individual's natural or adopted siblings, half and step-siblings that are under 19 when the individual is under the age of 19. Let's look at an example of a household composition. We have Sam and Sally. They're a married couple. They file taxes jointly, and they have 2 children they claim, Susie and Sarah, as their tax dependents. Their application has come in, and all are applying for medical assistance. So we know Sam and Sally will be together because, number one, they're married. But let's take a look at Susie and Sarah. Even though they tell us they're claiming them as tax dependents, we must still ask those 3 questions. So for each, we would ask the following. Do either Susie or Sarah find themselves being a tax dependent of someone other than their spouse, which they don't have, or biological parents, adopted parents, or step-parents? And as you can see there, the answer is no. Do either Susie or Sarah find themselves living with both parents who do not expect to file a joint tax return? And again, the answer is no. Are Susie and Sarah expecting to be claimed by non-custodial parents? And the answer is no. So when their household composition is formed, you will see the following. Each person is evaluated in a household of their own, but each household also includes the same 4 people. That's because with our tax filer household, the tax dependents, Susie and Sarah, were not accepted out for any reason. So for Sam, we have himself, who's the taxpayer or tax filer. We have Sally, who is the tax filer's spouse. And we have Susie and Sarah, who are their 2 tax dependents. Sally is the tax filer, so she's included. Sam, who is her spouse, and again, Susie and Sarah are the tax dependents. For Susie, she is a tax dependent who's living with tax filer parents, along with her sister Sally, who is the other tax dependent. so all 4 are included in Susie's household. And the same for Sarah, herself, her sister, as well as her mother and father. So this is an example of a tax filer household. Let's take a look at another example. We have Linda and her daughter Liza, age 15. They both live in the home together. Linda works, claims only herself as a tax dependent. Liza is claimed by her father, who does not live in the home, and medical assistance is applied for both. So what we've learned so far is Linda and Liza live together. Liza is under the age of 19, but Linda does not claim her as a tax dependent. Liza is a tax dependent, but she's a tax dependent of her father. So we have to ask, does any exception for tax dependents apply? So again, the question is she the tax dependent of someone other than her spouse or her biological, adopted, or step-parents? And the answer is no. Is she a child who lives with both parents, but they do not expect to file a joint tax return? And the answer is no. Is she a child who expects to be claimed by a non-custodial parent? And the answer is yes, because she is claimed by her father. So when we look at the household composition, we will see the following. Because the exception applies to Liza, we utilize the non-filer rules for her. So Linda would be a household of 1 person. She is a tax filer, but she does not claim her child as a tax dependent. Liza, on the other hand, will have a household of 2 persons, herself and her mother Linda, because as a non-filer child under the age of 19, her mother must be included. This is her natural parent. Let's look at this next example. This is a non-tax filer household. Again, we see Sam and Sally, a married couple. They do not expect to file federal taxes this year because the only income they have is unemployment compensation. And unemployment is taxable income. So keep in mind, you're taking their declaration. They live with their child, Sarah, who's age 18, and all apply for medical assistance. Sam, Sally, and Sarah are not considered taxpayers, and no one is claimed as a tax dependent. So their household will be based on the MAGI non-filer rules and will include the following, as long as these persons live with the individual spouse, any natural adopted children or stepchildren that are under the age of 19, any natural adopted parents or step-parents if that individual is under the age of 19, and the natural adopted siblings, half and step siblings that are under the age of 19 if the individual being evaluated is under the age of 19. Let's see how Sam and Sally and Sarah are composed. The MAGI households are as follows. Sam has 3 persons, Sally has 3, and Sarah has 3, because we are looking at non-tax filer rules. For Sam, he's a non-filer household who is married and has a child. So the spouse and the child under 19 is included in the home. Sally, again, is a non-filer household who is married and lives with a child under 19. Sarah is the child under 19 who is a non-filer household, and she lives with both of her parents. So as you can see, Sam, Sally, and Sarah each have 3 persons in their individual household compositions. Let's take a look at a tax filer income example. We have a single parent and 2 children. John is the parent, he's 38. His 2 children are Jack, age 6, and Betty, age 10. He claims them both as tax dependents. They live in a Group 2 locality. So the households are composed as follows. John is the parent. He's a tax filer with 2 tax dependents, so it's himself, Jack, and Betty. Jack is a tax dependent who did not meet any of the exception rules, so his household includes himself, his taxpayer parent, John, and his sibling, who is also a tax dependent, Betty. Betty, the same situation. She is a tax dependent living with her taxpayer parent, John, and her tax dependent sibling, Jack. Now let's look at the income. John is earning $3,000 per month. When we look at the potential covered groups, he meets the parent with dependent child definition, so he's potentially covered for Life C and Plan First because of his age. His children meet potential covered groups of the Medicaid Child Under 19 and FAMOUS. Beginning in October, the following income limits will apply. For Life C, in Group 2, for a household of 3, the limit will be $556. For Medicaid Child Under 19, at 143%, a household of 3, the limit will be $2,329. For FAMOUS, it will stay at 200%, and the household of 3 limit will be $3,255. For Plan First, the monthly income limit will be 211%. Remember, this will be effective for October 1 through December 31 of 2013. And for a household of 3, that amount is $3,436. And just in case we have to use it, the 5% disregard for the household of 3 will be $82. So when we look at determining eligibility for John, we've already established his monthly income is $3,000. And when we compare that $3,000 to the Life C limit for 3 persons, he well exceeds that limit. So he would be entitled to a 5% FPL disregard. When that $82 is subtracted from his household income, we find his countable income to be $2,918. John's countable income still exceeds the Life C income limit of $556 for his household of 3 people. So we now will compare his gross income to the Plan First income limit of $3,436. John, unfortunately, is not eligible for full coverage medical assistance, but he is found eligible for Plan First. Remember, Plan First is limited coverage. It is not full coverage. So, although the slide is showing the worker preparing this notice, our VACMS system will prepare notices for us. So, the notice is prepared to indicate that John does not meet full coverage medical assistance. He's denied for that, but he is approved for Plan First coverage. So that Plan First coverage will be authorized with an AC code of 080. And because he's only receiving or eligible for a limited coverage, we will refer his application to the health insurance marketplace so they can determine his eligibility for any advanced premium tax credit payments and see what type of full coverage health insurance he may possibly be able to purchase. So let's start to look at the children. First is Jack. Again, Jack's household income is $3,000. His father is the only one with income. The children do not have any. That $3,000 exceeds the limit for children age 19 for a household of 3, which is $2,329. So again, Jack is entitled to that 5% disregard we spoke about. We already know the countable income will be $2,918. So now the countable income is still exceeding that $2,329, which is the 143% FPL for a household of 3. So now we'll go back and look at the gross income of $3,000 and compare it to the famous income limit of $3,255, and Jack is now eligible for famous without the 5% disregard. Hopefully you're beginning to see how this will work. Betty's eligibility will be the same as Jack's. Her countable income again will be looked at, $3,000, compare it to the 143% FPL. It's exceeding that limit. When we evaluate her for famous, she is eligible. So both Betty and Jack will be eligible for famous. That notice will be developed and sent to the family to let the household know John is eligible for Plan First. His children, Jack and Betty, will be enrolled in a famous aid category. Let's look at some important dates relative to MAGI. Beginning in October 1, the new MAGI rules for new MA families and children applications will begin. The ADAPT system will no longer accept new MA applications beginning October 1. Also, the Cover Virginia Call Center will begin operations, and remember, they will be accepting telephone applications for medical assistance. On December 31st, 2013, that will be the last day to apply for famous moms. January 1, 2014, the following will begin. Famous cases will start to be returned to the local agencies via the VA CMS. Presumptive eligibility will be conducted by hospitals for MAGI FNC applications only. The federal marketplace will begin operations. Our new covered group, the former Virginia foster care children under age 26, will become effective, and Plan First income limits will reduce to 100% of the FPL. On January 31st of 2014, the famous CPU will end operations. And April 1st of 2014, families and children renewals will start using the MAGI rules. Should you have additional questions regarding MAGI, please email them to magimedicaid@dss.virginia.gov. Should you have any questions about benefit programs training, please feel free to contact Denise Short at denise.short@dss.virginia.gov.